Now, as we move into the stomach meridian, we have various stomach points here, right, that are along the edge of the SCM. We have, stomach 9, right? And then stomach 10 is right where the SCM attaches to the clavicle, okay? So whether we look at this from a traditional meridian perspective or whether we look at this from a myofascial perspective, we find that the SCM muscle is closely associated with the stomach meridian, right? And then the SCM is attaching to the medial border of the clavicle. This likely has something to do with why we can use stomach points like stomach 38 to treat shoulder pain, because we have a biomechanical mechanism for how this point can work through the fascial line on the SCM and on the clavicle. Okay, that's how I suspect that that point's working for that. It's part of it, at least. There's neurological things, we can think of it in terms of chi, but here we have a biomechanical model, and it'll be good to check in with our osteopath and PT friends because they can get really precise about understanding clavicular maladjustments and how that can affect that. Now, speaking of like the stomach points for shoulder pain, remember that if you look into the Master Tung points, you'll find that there's other points that are on that superficial front line. So the superficial front line is equivalent to the stomach meridian in many ways. It includes the SCM, right? And we've got stomach 9 and stomach 10. And then from there, the fascia that connects to the sternum and the sternalis muscle is a part of that line, stomach. And then we got rectus abdominis being a part of that. We got rectus femoris in the quads, vastus medialis, vastus lateralis, and then tibialis anterior is a part of that superficial front line too. So here we have a myofascial model for why these stomach points here can affect these distant regions. Now, the 3 weights here down near the ankle, they're used for what in the Master Tung system? What are the conditions of the neck and throat? Yeah. Hyperthyroidism, right? So myofascially, we have a direct connection there. Now remember that I said those more distal points produce generally stronger Daichi and a stronger CNS response up higher. So we've got these spinal loops that happen. When you put points in here or points that aren't too strong or points in the abdomen and torso, a lot of these points are working on the spinal loops and that neurological signal isn't getting to the higher CNS. But the more distal points on the hands and feet, you'll find, remember in our imaging, they image the head and the face, right? So the way that I understand that biomedically is that those stronger neurological responses from points like this are making it higher up. So these points aren't just working on the myofascial lines to regulate hyperthyroid function, right? But, so what are they doing? They're producing a stronger neurological reaction that's likely working within the hypothalamus and the ANS, and through the hypothalamus, then we get that modulation of the hormones, okay? We don't find that with some of the other points that they're able to regulate the hormones so much, especially if you come proximal. Think of some of the points that we use for hormonal conditions. Fu Ke is an example, right? Like right there on the thumb. It's a distal point, right? Liver 3 is great for menstrual stuff and gynecological conditions, right? It's a distal point. If you look at all those that are involved in hormonal conditions, they're more distal because of that stronger neurological reaction that's making it up to the brain and modulating endocrine responses, okay? And there's evidence of that, and with the urinary system as well. It relates to the craniosacral dynamic, it relates to the distal points, and some other things involved too. But so for hormonal conditions, more distally. Now let's go back to the shoulder, right? So the superficial front line, if we go down, we've got the 4 horses here, okay? And myofascially, we did those exercises where we squeezed our abdomen, right? Squeeze your abdomen now, tighten your rectus abdominis as much as you can. Can you feel that in your thighs as you do that? Yeah, you can. That's the chi, that's what's called the force transmission. If you contract your abdomen really tight, you're gonna feel that move through here. That's the myofascial response, okay? You also feel it in your chest, in your sternum, squeeze your abdomen again. Yeah, feel it into your sternum. So just these simple exercises clearly demonstrate through your own feeling, through your own embodied feeling, you can feel these myofascial lines. And as you do more and more practices and develop greater body awareness yourself, and as you do your Qigong meditations, you may even be able to squeeze your abdomen and feel something happening tibialis anterior. Try that. How far does this go down? You can feel it in your thighs easy enough. You can feel it to your knee. Yeah, it's harder. I'm not even sure I can feel it in tibialis anterior, but the point is that when you squeeze a big muscle like that on that line, you can feel it move in the adjacent sections between the chest and the thigh. Okay, so palpating this line too, most of the time I'm starting with these points on the stomach meridian. Okay, if I'm treating gastrointestinal conditions, right? We've got the 4 flowers in the Tung system. We got stomach 36. What's the difference? When do we use one over the other? What was the location of the 4 flowers? We've also got, besides 3 miles, Susan Li over here. And those ones are really kind of weird because the location is like, it's 1 sun posterior and then 1 sun down. It's really difficult to keep in track. Don't worry about that, okay? These are all on the superficial front line. The first 2 groups, the 4 flowers, is along the edge of the tibia. Right? So I'm going to place my thumb on the edge of the tibia, much like we do when we palpate for stomach 36. But rather than looking for stomach 36 being 1 sun away from the edge of the bone, I want to put my attention on that space between the edge of the tibia and the tibialis anterior. You can feel that there's an edge to the muscle and there's an edge to the bone, right? And that edge, you can feel like a structure under there. It's the fascia. It's the connective tissue, right? Can you feel that? Now,
I see 1 finger breath.
Yeah, 1 thumb, 1 sun, 1 finger breadth.
Yeah, I thought it's small.
Okay, so don't worry about those technical little things
no,
like
in the
that,
sense
right?
that helps find tibialis, because if this is too far, but if you're a little bit closer, then you feel it. That's what I mean.
So palpate the 4 flowers. It's between that space, and it's common to find nodules in there. I like to needle those little nodules. You can sometimes get a stronger response by needling those rather than needling stomach 36, which is in the belly of the muscle. So we've got a few different yang lines here. We've got the 4 flower line right along the edge of the bone. We've got the tibialis anterior, right? And then we've got, what's the next muscle over? We've got extensor digitorum. So extend your toes, pull them back. Can you feel contraction up there? That's the extensor digitorum longus muscle. And then those are where the beside 3 mile points are at. Okay, so we've got the 4 flowers, stomach 36, stomach 37, and then in extensor digitorum longus, which is also on the superficial front line, we've got those points. Now, those points are also indicated for similar conditions like shoulder pain. They work a lot like stomach 38. We're still on that superficial front line, right? So if you're using stomach 38 and getting a good response for shoulder pain, but then they reach a tolerance and you're not getting a strong reaction, start to palpate up here around Susan Li, and then you'll find, oh yeah, those are more sensitive than stomach 38 now. Or palpate the 4 flowers and you'll find, oh yeah, those are more sensitive now than stomach 38. Let's try those. And then guess what? You do those, you change your point prescription slightly. I'm still on the stomach meridian really. I'm still on the superficial front line, but I'm tuning in to the ashi points, the sensitive points, finding where the tension is being held. Because it will move. You can only needle that point so much. The tension is going to move. It may shift from stomach 38 up to Susan Li in extensor digitorum longus. And so this is like a meeting point for the Yongming channels. It's the clavicle. That's 1 point at least, because we've got on the medial edge of the clavicle, we've got the SCM, right, attaching, and then on the lateral side of the clavicle, we have the deltoid, which is large intestine. So you can think of the clavicle as being like the meeting bone where you got one side the stomach meridian and then the other side the large intestine, meeting point for those. So lateral and anterior shoulder pain. If it's more posterior, then we're going to use a different point group. I might add those, but depending. If they have like the forward shoulder hunch and the contractions here, right, in the pecs, and they're getting pain from strain in the back, then we still want to release those front line muscle groups. So you could use that to reach in the front line, but then we're also going to want to do stuff with the back line. Okay, so moving from here though, we got the space between the bone, tibialis anterior, we got tibialis anterior, we got extensor digitorum longus. What's the next muscle as we move lateral? Peroneus longus. And that puts us in the lateral line. That's gallbladder meridian. Okay, let's not go there just yet. Let's continue to think in terms of 3 segments. So we've got the thigh points, right? And on that superficial front line, we have a few different groups. On the more lateral part, on the stomach line, we have the 4 horses, okay? And then in the middle part, we have 88.01 through 88.04. Those are the used for heart conditions. You asked about that earlier, okay? So we got lung here, heart here, and then the passing through kidney points, 88.09, 88.10, 88.11. These are really easy to palpate, okay? Make sure that you're palpating and not just going for textbook location. I just find it's much more beneficial to just start palpating and asking the client if they feel anything sensitive. I like to use the edge of my thumb right there. If you use the palm, it's maybe a little too soft, but if you just slightly adjust it and you press that edge of your thumb into those lines, then they're going to feel it a little more. Which one do you feel more, like in terms of sensitivity? Around there. Okay, so we have a sensitive point there. Remember, you do want to use the 3 points together when you use these points. You can get away with using 2 points down here because they're more sensitive, right? If it's a really sensitive person, you can use 2 points on the lower legs or the forearms. A lot of the Dalmas, though, in the Tung system, they'll use 2 points on the hands or feet, right? Because they're more sensitive. You don't need 3 points. Often we do the Lingu Dabai Shabai as 3 points, but you can replace that point prescription with Yao Tong Shui and Sanjiao point at the base. Those 2 points for lower back pain, they work very similar. I haven't been able to distinguish any difference between doing that and Lingu, Dabai, and Shabai. Notice the nerve distribution too. We still got a wide nerve distribution. We're not just doing 1 line, we're doing 2. Try that out. If you're using Lingu, Dabai, Shabai and getting a good response, just try that and you'll find that you get a similar response. Okay, and then you can palpate these points too. See how easy I can just palpate that and see? And we did find on someone that 1 line was more sensitive. This one feels more tight on you over here than it does on the Sanjiao line. So if I put a needle in there, I'll probably find that I get a stronger needle reaction on this point than this one. Okay, so we've talked about these. We can palpate to find where the sensitive points are at. Okay, very easy to do this. And because this middle line, so we've got the stomach line for the lung points, but we've got the middle line for the heart points, test that out too. If you have a client with a heart condition or hypertension or a circulatory disorder and you're thinking of using these points, still palpate along that line because myofascially and neurologically, we're on the same myofascial line and we're likely in the same myotone region as well. Okay, so moving down the leg, I'm always asking myself, like, not only what points I'm using, but what region am I going to do? If this person is a non-responder and they don't get needle sensation very easily, I'm going to be using the hands and feet. Okay? If they're more sensitive, or if they're very sensitive, I may be more inclined to use the points up higher, more proximal, generally less sensitive. And try to get a good mix too. And this relates to, I think, some of the 5 element styles and to the balance method teachings. You don't necessarily want all your points on the hands and feet, right? Because the points here on the lower leg, they're going to generally produce a stronger myofascial response because you got bigger muscle groups and you got the convergence of the tendons in these areas for these big muscle groups. Okay? So, and you can quickly palpate, down the stomach line. This doesn't have to take a whole lot of time, right? Like I can palpate and find, there, I palpated the first line between tibialis anterior, the edge of the bone, 4 flowers. Now I'm palpating tibialis anterior in stomach 36. A little tension there. And you don't necessarily have to put all 3 points on the same line either. Like I felt more tension down here, and she's saying yes to that. So I can sink a needle in between the tibialis anterior and the edge of the bone, right? And then I can do another one around stomach 40 where I feel more tension. And then I can either do like stomach 36 or the 4 flower close to the bone. It's all superficial front line. Neurologically, it's very similar, but I'm reading her body, where the tension's at. I'm asking for verbal confirmation. Where do you feel the tension? Those little adjustments, rather than sticking with some of the textbook point protocols, I think are really important. I just want to drive that home. I think most of you got it now, but there's a lot of variations in the way that you can do this, and I don't think I've discussed the way that you can do it on the stomach line. Okay, so moving to the feet, right? These points mean gene 66.05 and then stomach 44. I like to do the stomach 44 point just a little bit more proximal. 43. Well, stomach 44 is between the web, right? So stomach 42, move proximal to the junction where the bones meet, get a stronger response, and then also the rather than stomach 44, yeah, you're moving towards stomach 43. You get a stronger response. You don't need to do 3 points there for digestive or menstrual things, but for the sinus conditions, you do, as Dr. Tung taught, you get at least 4 or 6 needles between the metatarsals. At this point, I tend not to needle them for digestive conditions, as good as they are, because they're very sensitive. But in acute conditions, you know, I treated someone here that had really severe food allergies, allergic to gluten, dairy. If they ate anything like that, like they would just be in severe pain and have diarrhea, and then 2 or 3 days to recover from that. A little slipped in from one of the meals one time that they didn't know about. They started to go into reaction. She was very concerned because she had a number of events planned that she was participating in. She's like, oh, this is going to ruin my trip because I ate gluten and now my class is starting next week and now, you know, this is terrible. So I did those points quickly after when she first started feeling it. I was able to do those points, 66.05 and then stomach 43, or the sensitive one there. And then it was the most incredible thing. Like the pain stopped, she was able to go to things. It didn't wipe her out like it typically does. And that was all I did, was just those 2 points. She was a needle-sensitive person. I'd worked with her before, so I knew her sensitivity. I didn't want to needle those because I know she's reactive, but I told her, I said, look, to do this, we're going to just have to do 2 points. Just give me 2 points and let's see what we can do. I don't want to do 8 points on her, right? She's not going to like that. She's not going to be happy. She's going to have tears, and it's going to be too much. Just give me 2 points. And sure enough, like those 2 points, we're able to do that. Okay. Now, a nice little thing you can do with palpation here, stomach 41 too. This is a nice thing to do. Let's say you put some hand points in. It can be for any type of condition. Maybe you're working the Yang Ming system and you're thinking about needling these points here. Maybe you've done Ling Gu and Dao Bai in that 3rd point in the middle. Maybe you've done 2. Maybe you've done 3. Maybe you've done a combination like, you can do Ling Gu and Li4 and Sanjiao 5. Maybe you've done that for a digestive thing, or maybe you've done Ling Gu, Li4, and Sanjiao 6 for constipation. You're thinking about doing some needles down here. Well, a nice little thing you can do, and this is kind of similar to doing pattern identification. I think it is a form of pattern identification. So what I'm going to do is I'm going to put my thumb on stomach 41, right? And then from there, I'm first going to palpate down the liver line between the 1st and 2nd metatarsals. And I might even do that a few times, just to get a sense of how sensitive it is. Okay, and you can go up and down one line several times, or if you want to be quick about it, go down the liver line and then go back to stomach 41 and then go down the 2nd line, the stomach meridian, right, and palpate that, and then go back to stomach 41 and then palpate down that between the 3rd and 4th toe. Now, we don't needle that line really. Like I have before just to see what will happen, but that one's a little more difficult to needle, and you don't need to, okay? And then go back to stomach 41, and then palpate again down the gallbladder line, right? And then just compare those. And that's a nice thing to do. If you're doing it slow, I kind of race through it there, but does that feel nice, Shaf? It's like a nice foot massage technique. She's going to enjoy it. And then I'm going to find exactly what points I want. Now, each time I massage down a line, it's going to desensitize her a bit, which is good for when I put my needle in, but it's also going to sort of uncover some things too. Like I may notice that there's tension first in one area, and I think, oh, maybe that's a good one. But then if I do this a couple times, maybe one of the points will become less sensitive, and I might find that what I initially thought was the best point, actually it's looking like it's going to be better to needle the gallbladder meridian rather than the stomach. So I might do liver and gallbladder rather than the yang ming stomach and jui yin set. Okay, so we've got the jui yin yang ming set where you can needle the liver line and the stomach line, or we've got the internal-external relationship with the liver and gallbladder. So if it's digestive, I may be more inclined to needle the liver and the stomach lines because of the jui yin yang ming digestion connection. But if it's neurological or the xiao yang symptoms are affected, I'm probably going to needle the liver and gallbladder lines instead. Okay.
For
and then,
headaches.
What's that?
More headaches.
For headaches or anything neurological. Or if that Zongfu pattern is present, then I would be more inclined to do that. So that's a nice little technique. It feels great. Stomach 41, down the lines, palpate, assess, and then make your choice. Rather than going and thinking in your head, oh yeah, stomach 45 is a great choice, I'm going to do that point. Well, see how that compares next to those other lines.